People have said that if you really want to see what a continued drop in childhood vaccinations looks like, read about that Samoan measles outbreak. 5,700 cases, 83 deaths, in large part by information put out by Robert F. Kennedy Jr., who is now our Secretary of Health and Human Services.
It's sort of a tragic case because it started all because of an accident. So what happened is 2 kids died after getting vaccinated. And the problem is they weren't actually given just the vaccine. A nurse made a mistake and accidentally pulled medicine that was a paralytic agent and gave it to the kid as well. So it wasn't the vaccine that killed him. It was this accidental poisoning with a drug. But the anti-vax folks like RFK and people he knew claimed it was the vaccine and told them it was that. And it scared a lot of people and they didn't vaccinate. And he actually literally traveled to Samoa to help promote this in mid-2019 before it all went down. The vaccination rate for kids, I think under 1, dropped from about 74% to 34%, which is just nowhere close. Somebody with measles traveled to the country and it just spread like wildfire. They had to close everything down, literally cancel Christmas gatherings, everything to get this thing to a stop because they didn't have enough hospital care to take care of that many sick people hospitalized. And so the deaths may have been partly exacerbated because they ran out of medical care. And that's the problem, like we ran into a COVID. If you let it go too fast, when you run out of ventilators and nurses and hospital beds, more people die. And so it was a horrible outbreak. And I think it didn't get as much press as it should have been, probably because that's right when COVID was happening. So COVID sucked up all the oxygen around. And so nobody heard much about this Samoan outbreak. But if you go read the articles about it, he was part of making it happen, unfortunately. And tries to dodge it when you ask him about it. And some videos of him being asked where he kind of hems and haws. And it's like, no, he was part of it.
It was just in the news again about the much anticipated study that he wanted to release, that he did release, Make America Healthy Again, which decried America's food supply, pesticides, prescription drugs. There's even pushback now from qualified real journalists, including the Associated Press, that the basis of the report isn't even based on facts.
The problem is it's a mishmash. There is some good stuff in there. There's accurate things. Like we do have problems with our food supply. We do have problems with our diet and lack of exercise. We actually do have those. So some of those things that they cite as causes are correct, but then they throw in lots of other things that are more in the conspiracy realm thing, for example. The other problem is they act like there's no research behind this. And actually, there's decades of research about what we need to do about it. The problem is it's hard to fix because there are political reasons why it's hard to fix. So like sugar-sweetened beverages, I've been working on that for almost 20 years. The problem is when you try to do something about it, a very well-funded beverage industry doesn't like you and they fight back pretty naughty sometimes. So some of the whole political thing is correct too. Yes, the food industry is part of fighting that, but some of their prescription is off quite a bit, actually. It ignores a lot of research. And now we've found out it sounds like they actually probably used AI or ChatGPT to write some of it, and it made up citations that actually don't exist. So it'd be comical if it wasn't someone in a pretty important person. You think they would have been smart enough to at least check the citations, you know?